for medication for all of my problems. You think you guys can help me out?
Yeah. Welcome to PharmUT. My name is Liliana. I'm a student pharmacist. How can I help you today?
So I'm looking for something to help me relieve gas. I've been having a lot of these pains, and it's really uncomfortable at this point. Can you help me with this?
Yes. What symptoms have you been experiencing?
So apart from having gas, like burping and flatulence, I've been having like pain on my sides just because it's like air getting stuck in there, and it's pretty uncomfortable.
Okay. Can you explain how the symptoms been affecting you?
So apart from having that pain and just having that annoying all day, it's kind of rude. I work a lot, and I don't want to be burping or going to the bathroom just to relieve myself. It's not really fun. So I'm trying to look for something that just make it go away for a while.
Have you experienced this before?
Yes, so when I was drinking a lot of milk in the past, it started to happen, and so I just dropped it, and it worked out fine.
Hey, Arsha, I'm a pharmacy student.
Hi.
I have a question for you. When did you start feeling the symptoms?
So I started these symptoms about 3 days ago, and from today it's like, it still hasn't gone. I thought it was going to go away, but they still haven't.
Mm-hmm. And what have you done to make the symptoms get worse or better?
So for getting better, I started doing massage and exercising, and it worked out pretty well. What made it worse was that I was eating too fast, so that's probably something that, or probably my diet too.
Okay, my name is George. I'm a pharmacy student. I have some questions for you. Are you currently using any prescription medication or over-the-counter product?
Yes, so I have vitamin D and a albuterol inhaler.
Okay, and do you have any allergies or medical condition that I should know about?
So for medical condition, I'm just asthmatic, and I'm just allergic to pollen and all these molds and stuff, just for my allergies.
Mm-hmm.
And do you drink any alcohol or smoke any nicotine
No.
product?
No smoking, no drinking. Is there anything that you guys can recommend me?
So, we're gonna recommend you Simethicone. It's known as gas relief. Would you like any counseling on the medication today?
Yeah, I'll be fine.
Okay, so this medication will help you to relieve the gas and the pain you got in your intestine, and this will make you feel less bloated. And they come in 150 milligram for the dose.
Yeah, as mentioned, this medication would decrease the gas, and the tablet we're giving you is 125 milligram. You're going to take 3 times daily after the meal, and there is 1 dose you take before bedtime. The maximum dose is 500 milligram per day, so watch out for that. And the side effect you may experience would be the gastrointestinal issues, mild diarrhea, nausea, and vomiting. And also it's safe to be used during breastfeeding or pregnancy.
Then some things you need to have knowledge of is there's no drug interactions, but you should avoid carbonated beverages and gas-forming foods like beans, bananas, and whole grains. Since this is an over-the-counter medication, it doesn't have refills, but another stuff you need to know is if you happen to miss a dose, please take one as soon as you can, and if it's almost your next dose, just wait until the next dose. Don't take over medication to make up for a missed dose. You need to store it at room temperature, away from moisture, and away from children and pets. And some additional things you should do aside of drinking this medication, you should eat and drink slowly, chew food thoroughly, and keep a food journal. That will help you know which medications or which food is going to help you with not having too much gas.
Okay.
So, do you have any questions for us?
I told this, everything was well explained.
Okay, can you please tell me, just to make sure you understood, what are the directions for the medication?
Okay, so I have to take 1 tablet 3 times a day whenever I need it, or I can take 1 tablet at night before bedtime.
Okay.
Just a quick note, so you're going to take 3 tablets a day after your meal.
Oh, after
And
my meal,
also
okay.
1 tablet before the bedtime, so it's a total of 4 tablets a
Okay,
day.
so that's good to know.
Yes.
After my meal. Okay.